So Dr. Alawali, I call him my angel doctor, discovered that kind of, I wouldn't say accidentally, but I was sent to him kind of as a third or fourth opinion, and he found it relative to what the work had been done. And then since then, he's done 2 venous ablations, and again, one on each leg, where he's kind of freed up the blockage that was in the superficial and the deep vein area of the arterial blood flow. And I still have one more remaining procedure to do where he's going to do some touch up on the peripheral return because I was not getting enough blood flow to my heart. So he's my angel doctor. I found his special touch was he had wonderful bedside manner. He also just has a real pleasant disposition. Instantly, I felt comfortable with him. Not I don't want to say that you distrust some doctors, but you just don't feel that level of comfort. And with him, I felt an immediate level of comfort. I just felt, he had such a brilliant knowledge of his field and even compassion for what I had encountered and understanding. I mean, I would give him terms of the procedures that I had with my liver, and he would get it instantaneously. I wouldn't even have to define those terms, which I found amazing, because his talents and focus obviously are in the vascular field, but my liver condition has some crossover there, and he really got it, and that was very meaningful to me and comforting. So and he in the pre-op consultation, he kind of explained it in common terms, and he was very patient and made sure that if you had any questions, he answered all your questions. And if by chance you thought of something after the fact, he welcomed you to call his office and get in touch with him, and extremely responsive. I emailed him one time after one of my procedures and told him that my leg was swelling, and he immediately got back and said, please make an appointment. And his office called me before I could call them and set up that appointment. So I really liked his follow-up and just his keen attention to what's going on with his patients, very much in contact with his patients. It was much more personal, and it also was more of a one-on-one focus than what you get in a hospital. Sometimes in the hospitals, it's really quick, and with Dr. Alawalia, again, his entire staff was remarkable and right on point with everything that needed to be done. And if you had a question, they were extremely attentive. If they couldn't answer it, they would go get the doctor and they would bring him in. I had 2 of my procedures in the Morgan Hill location, which is, an operative setting. And so he did my 2 angioplasties there. My venous ablations were done in the Los Altos office. And again, very, very considerate, very respectful. The staff was well trained, and Dr. Alawalia, he's always on time, usually sitting there waiting for you when you walk in the door. So it's definitely very personal, remarkable treatment that I've never really received from any of my other physicians. No pain, in my legs, no feeling winded when I walk up hills or even when I walk on flat surfaces. Historically, I have had some issues with feeling very short of breath and kind of unexplainable pain and not really understanding why. And then also swelling, so much so that at times, I've mentioned to my husband, I don't feel like I'm in my own body. I feel like, I'm retaining lots of fluid and I just don't feel normal. But since the procedures that Dr. Alawalia has done, there has been some improvement there. Like I said, I'm still encountering, somewhat a little bit of symptomatic kind of issues with swelling of the right leg, and there's reason for that, given my last ultrasound that he conducted that did just make some new discoveries that there might still be a little bit more work left to do on the other track that he has not really touched yet. Oftentimes I would go in, physicians would think I had a blood clot, and I would never test positive for that, thankfully, but they weren't catching that I didn't have normal return flow, which was impacting the breathing and the heaviness that I was feeling in my chest, almost like, a man having a heart attack. I would have the pain up my arm and the pain in my chest, like I just couldn't breathe, and I didn't really know why. So, I that's why I attribute Dr. Alawali as being my angel doctor, because he got it in almost instantaneously. Not almost, it was instantaneous. He said, I really do feel like I have a good grasp of what's going on with you, and it was a welcomed relief for me, and very comforting that I was seeing a physician that actually understood, not only the history, but also what needed to be done to go forward and hopefully improve that process for me. So you do have to be driven for the angioplasties. So and because there's some anesthesia involved, and that procedure, it took, I believe, a little bit less than an hour, but I was in recovery for almost 2 hours, particularly for the leg that was stented. The other leg, perhaps maybe a little bit more abbreviated, but still anywhere from a 1 to 3 hour interval was planned for those procedures. And then you rest when you go home and resume normal activity as soon as you can, but no kind of strenuous kind of activity like workouts or anything like that. And pretty much I felt fairly good, within about, I'd say, 48, 72 hours maybe. I was on pain medication initially, but worked to get off of that within a few days. And then the venous ablations, those they wrap your legs upon leaving the office, and you walk out of the office. It's done more kind of as a local, they do a little numbing medication on your leg, and then go in with a catheter, much like the angioplasty procedure as well. And then the next day, you can remove the bandages and put on the compression stockings, and you're to wear the compression stockings for 2 weeks. So that one was a little bit different, but again, a lot less pain, kind of more of a local, faster recovery. But again, recommended that you don't do any kind of high impact sports or anything for like a week or so following that procedure. They are when Dr. Alawalia performs them, I feel. That's certainly no disrespect to any other physician, but I mean, he just seems so spot on. I mean, he knows exactly what he's doing. And with the venous ablations, it was really kind of nice. My husband actually was able to observe the procedure, and that was really very informative to him. And Dr. Alawalia would explain exactly what he was doing at every juncture of that process. To me, and of course my husband was in there to overhear it as well. So we both came away with really kind of enhanced knowledge of the process, and could appreciate it a lot more, I think, than if you kind of wake up after a procedure and you don't really know what's done, and sometimes the doctor comes out and talks to you, and if they do, your spouse or your friends don't remember what they said, and so you're kind of scratching your head going, what really happened here? So, but I never felt that way at any point with Dr. Alawalia. Extremely attentive staff. Again, if there's any questions, need to reach the doctor, they're right on it. They're very clear in communicating what the follow-up process is, and the intervals in which you need to return, and if you have any questions, this is the number you need to call. And I've always never had a problem in terms of the efficiency of scheduling an appointment. They've been really very comforting in that department, and not pushing it out if you need to see the doctor. And I've also really appreciated having the email to be able to communicate with him via email, so that you use different mediums to get in touch with them if need be too. I think he's got tremendous compassion, and like I said, his knowledge just really expels. I mean, I felt extremely comfortable from the very moment I met him, And I knew that he was a doctor that knew what he was doing, and he wasn't going to fool around and kind of take you down this path to try this and try that, and if it doesn't work, he really jumped right to the situation and resolved it as best he could.